The Mental Health Act is a law in the United Kingdom that covers how a person with a mental health disorder can be detained and be assessed or treated against their wishes. This is more commonly known as sectioning. The first edition of this act came in 1983, but has since been updated. Overall, the act is divided into 11 parts, and each of those into further sections, making a total of 202 sections. We will cover those that are most commonly encountered. First, there are a few terms that we need to know. Most people are detained under the civil sections rather than the criminal sections, and approved mental health professionals are required for certain parts. These are mostly social workers, but more recently, clinical psychologists, some nurses, and other therapists have also taken up this role. Doctors also play a part, with some doctors that are Section 12 approved being a requirement. This is a doctor with specific expertise in mental disorders, and they are usually psychiatrists. Other professionals involved in the Act include mental health nurses and police officers. Section 2 is the first section that we will cover, which allows for assessment and can last up to 28 days without the possibility of renewal. Generally, this will require an approved mental health professional and 2 doctors, one of whom must be Section 12 approved. If the 2 doctors agree that the person is suffering from a mental health disorder and may be a risk to themselves or others, then the approved mental health professional will review, and if they are also in agreement, this will lead to the person being detained in hospital. It is possible to give treatment in this case without consent, as response to treatment is considered to be part of the assessment. Section 3 is for treatment, which can include medications like antipsychotics and also electroconvulsive therapy. Its duration is initially 6 months, but can be extended by a further 6 months, and at that point, if it is continued, would be extended by 12 months each time. The same professionals are required for Section 3. However, in this case, the doctor must have a specific diagnosis and plan established. After 3 months, an independent doctor must review to see if the proposed treatment plan remains the most appropriate option. It's worth noting that electroconvulsive therapy can only be given to incapacitated patients who do not have capacity to refuse, and that it doesn't violate any pre-existing decisions. Section 4 is linked to the previous 2. It is an emergency order that can be implemented when only an approved mental health professional and single doctor are available. We then have holding powers sections, involved in detaining patients who initially consented to admission, but have since decided they wish to leave. Section 5(2) is the holding power for doctors, which lasts 72 hours, during which another review should be carried out, which may result in sectioning via Section 2 or 3, or in discharge. The original admission does not need to be for a mental disorder for Section 5(2). Section 5(4) is the holding power of nurses, typically a mental health nurse, and ends under whichever comes first, either 6 hours or the assessment by the doctor under Section 5(2). Then there are Sections 135 and 136, used mostly by the police. 135 can be used if a person who is thought to be mentally disordered is not allowing assessment for sectioning in their residence. It allows for police to enter and take the person to a place of safety, typically a hospital, but may also be a police station. Section 136 is similar, but instead allows police to take people to a place of safety that, instead of being in a residence, are in a public place. In this case, people may be held awaiting a Mental Health Act assessment for 24 hours.